First on your feed at 5 today, the latest on the coronavirus. And we saw a very slight decrease in cases over the last 24 hours across Ohio, but we still reported more than 3,200 new cases. It was a dip of just over 100 cases from yesterday's number, but still troubling.
Yeah, today's number is the second largest since February, just after yesterday. And earlier, the Ohio Department of Health spoke about the virus and how we're seeing numbers go in the wrong direction. There's also an increase in hospitalizations and the use of ventilators, too, across Ohio.
Laura Queso has been following it all. She joins us now on What's New. Laura, good afternoon to you. We also today heard from the CDC. What's new regarding the continued talk about this booster shot? We may need that third booster shot for those that had two already.
Right. So right now, the FDA is working with Moderna and Pfizer, both companies, for this booster shot that you speak of for those who are immunocompromised. Dr. Anthony Fauci today said there is no need for the general public to receive an additional vaccine right now, but does think they will be needed later down the road as they continue to evaluate Delta. Of course, day by day, we know so much is changing. Meantime, as Ohio continues to see cases increase, so does most of the rest of the U.S.
And now over 90% of counties in the United States are experiencing substantial or high transmission. As we have been saying, by far, those at highest risk remain people who have not yet been vaccinated.
A new study by the Mayo Clinic found after 6 months, the Pfizer vaccine was only 42% effective during the height of the Delta variant. That's compared to Moderna's at 76%. But researchers did find both vaccines still offer great protection against hospitalization and also death, which is something that we've been talking about a lot.
Yeah, still worth getting, of course. Laura, let's go back to the booster shots for a second. Now, you said the FDA is going to be working with the drug companies to figure out when immunocompromised people should get this shot. When will they know that it's the right time to go and get dose number 3?
So this vote is expected really any day now. We're learning that it could happen as early as tomorrow. This is basically a special advisory panel, and they're discussing it right now. But in the meantime, we're hearing growing numbers of reports of people getting that third dose by saying they haven't had the vaccine yet. So that just goes to show people are really desperate right now. It's a little bit scary.
Yeah, because I'm not sure, I'm not a scientist, but is it the same shot 3 times? Is it a different version? I'd be afraid to do that.
I think it's the same shot 3 times because it's the only one that's out there. But I would say, again, no doctor, no scientist. Wait, wait for everything.
Wait till you have that official recommendation.
Exactly.
It's a good plan. Okay, Laura, thanks.
Hey, thanks.